The relationship between Ehlers-Danlos syndrome and anxiety. What is Ehlers-Danlos syndrome, or EDS? Ehlers-Danlos syndrome is a connective tissue disorder that affects all aspects of the body, including joints, internal organs, and skin. There are 13 known variations of EDS, which include classic, classic-like, cardiac valvular, vascular, hypermobile, anthrochalasia, dermatosparaxis, kyphoscoliotic, brittle cornea, spondylodysplastic, musculocontractular, myopathic, and periodontal EDS. EDS is known to affect at least 1 out of every 5,000 people in the population, with hypermobile EDS being the most common, though it is unknown how many people suffering with EDS are undiagnosed or misdiagnosed. EDS is thought to be inherited, with your likelihood of being born with EDS being higher if you have relatives with the condition. The average length of time that EDS patients must wait to receive their diagnosis is 10 to 12 years. Symptoms of EDS. Hypermobility is a common symptom in all variations of EDS. Regarding hypermobility, there's a sliding scale that ranges in severity from asymptomatic joint hypermobility to generalized joint hypermobility spectrum disorder, or GHSD, and hypermobile EDS. Often confused for joint hypermobility disorder, some believe that the two conditions are one and the same, or that EDS is simply a more severe version of GHSD. Skin elasticity, fragile skin, easy bruising, and scarring are also common side effects of the weaker collagen found in EDS patients. Those with the disorder often suffer from feelings of chronic pain and fatigue. Frequent dislocations from hypermobility make everyday actions more challenging and potentially hazardous. Hypermobility can lead to chronic fatigue due to the muscles in the body having to work overtime in order to keep joints in place, since the joint sockets that are responsible for keeping joints in place are too loose due to weak collagen. The increased strain of the muscles can also lead to muscular imbalance, causing some muscles in the body to be underdeveloped. Gastrointestinal issues found in EDS include heartburn, reflux, constipation, bloating, abdominal pain, and nausea, to name a few. Postural orthostatic hypotension, or POTS, is a condition commonly associated with EDS that causes syncope, dizziness, nausea, palpitations, chest pain, and shortness of breath during postural changes, like going from sitting to standing. Vascular EDS, which is the most severe variant of EDS, as well as the most rare, affects the blood vessels and internal organs, and has symptoms that can include internal bleeding and death. Here are some examples of what hypermobility can look like, as well as the scale for hypermobility severity. Anxiety and EDS. EDS is comorbid with anxiety and panic disorders, as well as other mental health conditions, including depression, OCD, and substance use disorders. Those with EDS are more prone to injury and often experience chronic pain that can result in constant worrying and stress. Increased stress can also lead to somatization, or the psychological manifestation of physical symptoms, and increases in pain. The limited awareness and diagnosis of EDS leads those who are undiagnosed and suffering to feel confused and distressed about their symptoms. Treatment for anxiety stemming from EDS. Physical therapy is an important tool for EDS patients that can help to improve proprioception, or the ability to understand where parts of your body are in space, as well as their movements. in order to decrease injury during physical activity. It is best for people with EDS to avoid activities like yoga that stress flexibility, since EDS sufferers often already struggle with joints that go past their normal range of motion. Instead, it could be helpful to incorporate strength training in order to strengthen the muscles around loose joints and meditation. Dialectual behavioral therapy, DBT, is a tool that is often used to change behavioral patterns and can assist in the alleviation of anxiety. Cognitive behavioral therapy, CBT, is the most commonly used form of therapy for treating anxiety and depression, and can be helpful in helping those with EDS come to terms with the condition. What can we do? The most important step for someone who suspects that they may have any variant of EDS is to bring up symptoms of EDS with your primary care physician. Early intervention is the best method of treatment for EDS symptoms. For those suffering from anxiety disorders, a key step includes seeking out mental health professionals for support, as well as trusted friends and family. Finally, spreading awareness of EDS will play a large role in getting an often overlooked portion of the population the help that they need to lead healthy lives.